I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. We're going to be discussing case number 01949. This case had skin issues, and I'm happy to go over this report with you. The base point readings are going to look for the underlying problem related to skin issues. The skin is like the lung, except it's an exterior lung. Because there's pores, the skin has to breathe, there's hair, there's oil that coats the skin. It's a detox zone as well. And so any skin issue is not necessarily allergies. Allergies we look at traditionally as any potential skin issue that causes itching, scratching, rash, etc. Allergies are the incorporation of sensitivities into the system that are no longer recognizable by the body as being a normal sensitivity. So if I have an ice cream allergy and I'm sensitive to it, if I have ice cream, I'm sensitive, I have a rash on the side of my face, for example, and if I don't eat ice cream, no rash. But an allergy is that I can, whether I'm eating ice cream or not, I develop the same rash because of the previous experience with that ice cream. And then if I do eat it again, it can be the tipping point to a much more serious inflammation or much more progressive type inflammation that can perpetuate skin issues. So that's unfortunately this case we don't see allergies in the base point readings, but we did see a couple of things. And one was a weak area in connective tissue, and then the stressed area is in the joints. So it's interesting, you might ask, is how do skin issues relate to connective tissue and joint problems? And nature provides us a molecular answer, but an expression can be much different. And so with skin issues, the lymphatic system is really, really important for moving toxin. And so if we have connective tissue weakness and joint stress, is we're going to see decreased mobility. And that decreased mobility slows the rate of lymphatic fluid moving byproducts out of the body, and so that can be the tipping point for inflammation. And so that's the reason for the underlying skin issues that we see on expression. And if we go into sensitivities, we want to see if there's anything that may be a tipping point for that. And so I'm going to bring those up. And as you notice that it's broken down by group and then subgroups. And so at the top of the list here we see environmentals, epidermals that affect skin, and then plant material. And so we go into poison sumac, oak, and ivy. Any contact with that any time of the year can set off and be a tipping point for skin issues on the surface. Poison ivy and oak and sumac have more of a type 4 hypersensitivity, so more of an immune-mediated reaction versus a typical allergy in which they might scratch a little bit here and there. This you can see more welts and inflammation. Humans that have poison ivy allergy complain more of welts and more advanced skin lesions related to it. And so we're going to see this in more trails and parks, but it can be in the backyard as well. So, and then the next set is we did see fabrics and materials, leather, mohair. These are common. Interestingly enough, Kleenex, Dacron, and cotton. These are fabrics and materials that are normal everyday household products, from the couch to the Kleenex we use to blow our nose, for example. And so those are going to be sensitivity points. If we're exposed to it, we're going to be sensitive. So that's going to be the trigger point and the tipping point for decreased circulation in the body from the connective tissue in the joints. But sensitivity can add inflammation on top of this to see more intense skin inflammation and skin reaction as well. So, and then finally we get into the food group, and in particular sweeteners. We're not going to see necessarily any of these products in dog food, but certainly if they get exposed to our food, And we see one of the more concerning ones is xylitol, which is in sugarless chewing gum. So we want to be aware of that. I know you won't be giving, giving chewing gum, but at the same time, if we're accidentally exposed to chewing gum, it could cause a more severe reaction to the skin and in general in the body. So how do we fix this? Well, first of all, is we have to control the current skin issue as naturally as possible. So we want to consider using herbal remedies to fit the pattern of inflammation. Second of all is we're going to be using a focus infusion drop that's going to balance out the sensitivities and the weakness and stress in the joints. I use a hemp oil infusion, and it's 3 drops a day for 3 months. And in the meantime, we're going to be following up with the skin and how it's coming along. Now the question is, will these drops immediately resolve the skin issue? And the answer is no, because if it were a simple skin problem, often they can be self-limiting with a short-term remedy or medication. Because it can be more chronic, we have to take time to condition it out of the system versus trying to control it. But if we're more intense inflammation, if they're uncomfortable, we can give them medications to help control the intensity of the itching and scratching until the body's conditioned. So using the drops, and then in the meantime we'll follow up in 3 to 4 weeks to see how things are going. If you have any questions, please call 847-541-4005 and we can set up a consultation by phone, in person. Feel that this is an ongoing process of communication mostly, and so in order to get better we have to make sure that we're staying on top of the things that are happening and to help them get better quickly. Thank you, and give us a call if you need us.